cancer sucks. It just sucks. And you know, it just sucks worse when it's your father or your friend or, you know, someday you. It's just, it's a part of life, and with this particular form of cancer, there is a lot of hope and a lot of things on the horizon, and it's really exciting. But it needs support, like, you know, like anything.
The MMRF has always been a leader in both oncology and in the nonprofit sector. And that's because we have this uncanny ability to look at the landscape, identify the obstacles in drug development, identify the partners that help provide the solutions, and drive the business models forward urgently.
It's not just enabling pharma companies with foundations, with physician scientists, with the FDA to work together, but it's truly the way that Kathy Giusti has put the model together as a business.
MMRF's model is powerful because it's disruptive. They are not trying to fit into the existing methodologies.
When we realized our scientists couldn't collaborate, we decided to build collaborative tissue banks and a clinical network with them so they could share tissue and conduct phase 1 and 2 trials. And when we realized how important it was to share data, we launched the Compass Initiative, a $40 million initiative where 1,000 patients have been sequenced, and we now have the largest genomic data set in the world today.
Pharma companies can look at the data and figure out the ideal population for their drug. They can look at the data and find, oh, I didn't know that that was a target for myeloma, and help reorganize their pipeline.
What MMRF has done such a good job of pushing is the idea that as soon as you get a piece of information, you should be sharing that. It's the difference between a cycle time that might be a year and a cycle time that might be weeks. We get so many more turns of the cycle, and progress goes so much faster if people share.
The MMRF has truly been a catalyst to bring people together, to foster collaboration through the academic medical centers with our pharmaceutical partners. But now it's gone to a whole nother level because we're engaging technology partners to start analyzing all the data that we've aggregated to determine actionable insights that'll make life better for our patients.
Why do some drugs work in some patients and not in others? To answer those kinds of questions, we need biological data, where patient samples are taken and you can compare them and say, okay, what is the pathway that's allowing these cells to escape this drug intervention?
So for patients, it provides this unbelievable and very credible resource on what to do next. So it's brought together patients from all walks of life. It's that patient community where the data is in their own cancers and their own physiologies that's providing a platform for discovery.
All these cancers are miswiring cells in very similar ways, and discoveries from skin cancer, particular genes mutated there, are turning up in multiple myeloma. It means we can move faster because we can draw on knowledge from one cancer to accelerate knowledge in another cancer. It's about one problem, cancer.
I believe we should be dreaming big and going bold and delivering on that goal. May we live to see a world with no cancer.
Without a doubt, MMRF is going to have played a huge role in the defeat of this, without a doubt.